Madam President, I want to begin my remarks this morning by taking stock of how the 115th Congress, led by my Republican colleagues, seems to be coming out of the gate. Here is what is coming if the budget process that began this week plays out. 30 million Americans from Portland, Oregon to Portland, Maine will be in danger of being kicked off their health care plans. Sharply rising health care costs for everybody else, even those who get their insurance through their employer. Broken campaign promises about a replacement coming on day one. And with this resolution, Madam President, Republicans in the Congress are building a Trojan horse of tax cuts for the most fortunate in America. I want to discuss each of those issues this morning, but first let's recognize the bottom line. What's at stake in this debate is whether or not America is going to go back to the dark days when health care was reserved for the healthy and wealthy. For nearly 7 years and through 4 punishing campaigns, Americans have heard and felt the steady partisan drumbeat of repeal and replace from the other side. Dozens and dozens of show votes to repeal the Affordable Care Act have been held in either chamber. There have been countless press conferences, speeches, and hearings, even a government shutdown. And the message was always the same. The president-elect himself said repeal and replace would happen. His words, not mine, Madam President, simultaneously. The replacement plan was coming. It would be fully written, ready to plug in, no gap, no harm to anyone in our country. The same words, coming soon, have sat on that marquee for 7 years now. It seems to me it's time to admit that the show won't open. This is a broken promise, plain and simple. Americans are no longer looking at repeal and replace. Now it is repeal and run. And the consequences will be serious and immediate for tens of millions of Americans, both in access to health care and the bottom line for family budgets across the country. In short, it's a plan that will make America sick again. According to independent analyses, nearly 30 million Americans will lose their health insurance quickly after repeal. The first act of a new Congress, kicking 30 million people off the insurance rolls. That is 7 times the population of my home state. The overwhelming majority of those 30 million Americans are not wealthy people. They're not in a position to just be able to afford to go out and pick an expensive plan once the insurance companies get back in the driver's seat. Millions come from working families that will lose tax cuts for health insurance. Millions of others toil, often working multiple jobs, but still what they bring home is just barely enough to keep them out of poverty. For many, signing up for Medicaid brought an end to the years and years when they had to choose between visiting the doctor and putting food on the table. If repeal goes forward, Americans all over the country are going to face that dilemma once again. And I think it's important to remember that the danger of repeal doesn't end with Americans getting kicked off their insurance plans. Repeal will send costs skyrocketing for everyone across the board, even those Americans who get their insurance through work, including a lot of folks who say the Affordable Care Act hasn't touched them at all. They're going to get a gut punch with higher premiums and higher out-of-pocket costs. When you kick tens of millions off the insurance rolls and send the markets into chaos, there's going to be a ripple effect, and everyone is going to feel those harmful effects. Even those who've had the same plan from employers, a particular employer, for years or decades. Rising costs are going to eat into paychecks, crowding out the pay raises that our people need so desperately. Colleagues, if you're watching this budget debate at home, I'm sure you're going to say, why in the world would any lawmaker go forward with this plan? And I'm going to go back to what I just said. In my view, this is a Trojan horse of tax cuts for the wealthy and the most fortunate. When you look at both sides of the ledger, you see how exceptionally unfair this scheme actually is. On one side, tens of millions of Americans lose insurance and suffer economic pain. That's the typical family. On the other side, substantial tax breaks for those at the top of the income scale. One of the questions I've asked nearly every day in these halls, and I'm asked this by many in the press and elsewhere, is whether Democrats are going to take part in this effort and what ideas Democrats would put forward. And I want to take just a minute to describe why that question is so off the mark. First, you have to look at the nature of the reconciliation process itself. Budget reconciliation is inherently a partisan exercise. Inherently, it's not a process that brings people together. It's a process that drives people apart. It's inherently partisan. A typical proposal that comes to the Senate floor is subject to unlimited debate and unlimited amendment. Usually it takes 60 senators, members from both parties, to come together and pass legislation. It is very rare that a party builds that kind of supermajority on its own, so the two sides have to work together. That's the Senate at its best. I see my friend, the distinguished chairman of the Budget Committee, Senator Enzi. He and I have served on the Finance Committee. That's what the Finance Committee's always been about at its best, is trying to find common ground, working together to get a proposal that can get 60 votes. Reconciliation throws those unique characteristics of bringing senators together. Basically, reconciliation just trashes it, just throws it out the window. In my view, when you use reconciliation the way it's being used here, you're telling the other party you neither need nor want their votes. It puts a one-sided proposal on the fast track to passage. Tight limits on debate and amendments, a bare majority of votes required to actually pass it. So I'm very concerned that what's at issue now is a serious misuse of the reconciliation process. This is not a simplified procedure to address a budget issue. This is an effort to ram through repeal and run. Second, this is not your run-of-the-mill congressional debate where you have both sides bringing their best ideas forward to tackle a policy issue. For years, my Democratic colleagues and I have said we are ready to work on a bipartisan basis to solve this country's health care challenges. Madam President, I think I have spent about as much time as anybody here in the Senate working to try to find bipartisan solutions to the country's big health challenges. Back in 2008, 2009, we had a bipartisan proposal. 7 Democrats, 7 Republicans, never had that before. And I can tell you, Democrats, we're ready to work on a bipartisan basis to solve the country's health care, challenges. And for me, it's essentially what I've tried to make my top priority for public service. Health care is 1/6 of the American economy. It's always been the issue that Americans care the most about. Because if you and your loved ones don't have their health, nothing else much matters. So we ought to be working on a bipartisan basis to solve the country's health care challenges, finding ways to bring costs down for families, making prescription drugs more affordable, upholding the promise of Medicare and strengthening its guaranteed benefits. Madam President, when I was director of the Great Panthers at home, the senior citizens group, we always said Medicare was a promise. It was a promise of guaranteed benefits. And we ought to strengthen that promise, particularly updating it to incorporate changes in the program that reflect the needs of Americans who face chronic health conditions, which is where the vast majority of the Medicare dollar is going. That's what we ought to be doing, is upholding the promise of Medicare, working together in a bipartisan way. But that's not what's happening here. And from the other side, what we've heard again and again is repeal and replace. Dozens of partisan votes producing legislation that burned out in the Senate or met the veto pen. Now, with the new administration, the Trump administration coming in, the Republicans kick off a procedural scheme that slashes taxes for the most fortunate, raises costs for typical Americans, and takes insurance coverage away from tens of millions of people. No Democrat is going to buy in to that proposition, and the reason they won't is because the American people are not going to buy in to that proposition. This scheme is going to bring on a manufactured crisis that does harm to millions of Americans across the land, rocks our healthcare sector, our providers, our plans, all of those who make up this healthcare system. One side is pushing it. The other side is saying, no, let's not create this catastrophe. That's why, in my view, the questions about Democrats signing on to flawed, bad proposals miss the point. Madam President, everyone recognizes that the strict and immovable political strategy adopted by the other side 8 years ago paid dividends in elections. But politics is different than governing. Politics is different than governing because there are serious life and death consequences to actions that deprive Americans of health insurance. Families are going to feel economic pain when premiums and deductibles jump. And I believe Americans are going to speak out. They're going to rally against an unfair, unbalanced bill that cuts taxes for the most fortunate while putting insurance companies back again in the driver's seat. So what's at stake here is pretty simple. It's whether or not America is going to turn back the clock and go back to those dark days when health care in our nation was reserved for the healthy and the wealthy. My colleagues and I say, no way, and we're going to fight that unfair, imbalanced approach in every way we can. With that, I yield the floor.